The cast includes metal rods made out of titanium that surround the bands in order to align the fracture during the healing process. The titanium rods begin at the top of the cast, weighing 1 pound each, and slowly decrease until each rod weighs 1/4 of a pound at the lowest band of the cast. During the healing process, each row of rods can slowly decrease in weight as the fracture heals. The weight will promote osteoblast activity, which can result in a more rapid healing period for the patient.
Around the area of the knee, there is a spring-like netting material that connects both of the titanium foam gripping areas of the cast. These allow for a slight movement of the knee. Covering the area of the leg by the ankle and foot, there's a foam material which allows a patient to have a stable and comfortable cast. There's also a plexiglass door portion that overlooks the incision and allows a patient to check in on their incision in case of infection, and allows for easy access for the doctor to adjust anything if needed.
In order to properly enhance and test the peekaboo cast, 6 user needs had to be tested for. This includes preventing infection, maintaining bone alignment, providing vascularity, promoting osteoblast activity, maintaining calcium homeostasis, and promoting comfort to the patient. To test if the peekaboo cast could create an infection-free environment, a liquid culture bacteria test was completed with positive results, meaning that no antibiotics would be needed unless results proved otherwise. An X-ray was needed to test if the patient's bone maintained its alignment, and a blood pressure test was used after the cast was placed on the patient in order to ensure the peekaboo cast proved sufficient vascularity. Both of these also proving positive results.
To ensure that osteoblast activity is promoted, the cast was weighed to find that at least 1.5 to 2 pounds of weight were accounted for. Then, in terms of maintaining a calcium homeostasis, the patient needed to take a calcium blood test proving that they maintained 8.5 to 10.3 milligrams per deciliter of blood calcium from the provided calcium patch. Lastly, the cast had to promote comfort. To prove this, 5 participants were surveyed of their opinions regarding itchiness, immovability, and irritability on a scale of 1 to 10. The average score for itchiness was a 4, for heaviness a 2, and irritability averaged to a 1.8. Therefore, because the lower the number, the more comfortable the cast was found, the overall comfortability of the cast proved successful.